Welcome back. Now, the Coptic Orthodox Church in Namibia is hosting a medical team that is from the Coptic Medical Association of North America, that is CMANA, for an annual medical mission to Namibia. CMANA team will be engaged in surgical procedures done in Windhoek Central Hospital, Katutura Hospital, and Omaruru hospitals in the fields of plastic surgery, gynecology, neurosurgery, ENT, and general surgery, just to mention a few. With more details on this, I'm now joined by the leader of the CMANA Coptic Medical Association of North America, that is Dr. Professor Hani Ashmala. He's the head of the radiation oncology at the hospital in New York, USA, as well as Dr. Basen Henry Fauzi, who is a deacon in the Coptic Church in Namibia. Thank you so much for joining us.
Thank you for having us.
Very well. Starting with you, Dr. Fauzi, please talk to us or take us through the operations of the Coptic Orthodox Church in Windhoek.
Okay, thank you very much for the invitation. First of all, I would like to mention about the Coptic Orthodox Church, which is the Christian Church of Egypt. Its establishment was in the middle of the 1st century by Saint Mark the Evangelist, and he is the writer of the book of Mark. Which was like the earliest written gospel, actually. And he established the church there and was martyred there as well. So Alexandria was like one of the first main sees of the apostolic mission, like Jerusalem and Alexandria. And so that's how Egypt was evangelized by Saint Mark, and from there he formed like the church was started, and the church from that time has expanded all over the world, and we are part of in Namibia here. We have the presence of the church since 1990, and actually we're having 2 churches, one currently in Ondangwa, which was established first, and then the church in Windhoek here, in Pioneers Park Extension.
Okay, yeah. Great. Now, Professor, let's talk about, you are hosting the medical team, that is, or you are the team leader for the Coptic Medical Association of Northern America visit to Namibia. Talk to us about the purpose of this visit.
Sure. So this is our 4th year coming to Namibia. We do several missions in African countries, but this is the largest mission actually we ever had. We are close to 30 members. The purpose of the mission is manifold. One is to really do some surgical procedures that are very technically advanced, and we're bringing a very large team from all over the world to do them for certain procedures that we were asked to come to do. We also are asked to do some outreach programs through the Ministry of Education, to visit several high schools to teach the children some psychology issues and how to deal with self-esteem and bullying and other things. And the third is outreach for medical and pediatric places where we go to villages and outreach in jail and things like that.
Now, to ask a question on the difference between what you do, the work that you do, and what is called Doctors of the World do.
Yeah, it's very similar. We belong to the Church of Egypt, so there is always a background of a Christian message behind everything, although we do not differentiate the care for anyone regardless of ethnicity, color, or religion. But similarly to many aspects.
Okay, so you also respond to humanitarian crisis.
Exactly.
Okay.
I mean, all what we are coming for, though, are pre-planned surgeries.
Right.
Like today, for example, as we speak now, there is a large brain tumor being removed. There are 2 large ovarian and uterine cancers being removed. There is a child with his fingers are all attached, called syndactyly, is being reconnected. And I believe there is a skin cancer from the nose being taken out. That's all of this is just one day. So we are different than going, for example, in a viral epidemic. We usually don't do that. We usually are pre-planned surgeries, pediatrics, GYN, and other things.
And it's a team of specialists also.
Yes, so as you mentioned, rightly so, we have a neurosurgeon, we have 2 gynecologists, we have an ENT surgeon, we have 2 plastic surgeons, and they are going to do also something called reduction mammoplasty. A lot of Namibian ladies who may be breastfed for a very long time, they have a very large breast or causing severe back pain and shoulder pain. So they are doing actually a surgery like that almost every day for the whole week. Okay,
good. Now, CMANA has 3 dimensions for the operations. Can you please take us through this?
Yeah, sure. As I mentioned, we go for the medical part, and then the surgical part, and the third is outreach. The outreach is where we collaborate with Dr. Fauzi and his team to really reach out to those who may need not just medical care, but maybe psychology care or other things, and connect them if they need any Christian services. The medical and the surgical aspects or angles or routes are the ones I mentioned. We, for example, have 400 high school kids we are visiting every day through the Ministry of Education, through the Ministry of Health under the guidance of the Executive Director, Dr. Bengombi. He really facilitated the whole trip for us to visit Central, Katatura, and many other hospitals, and all the chiefs of sections have prepared lists of surgeries. Our last sort of route of action is to teach our colleagues here in Namibia, whether they are nurses or surgeons or anesthesiologists, how to do what we learned in America.
Okay. Dr. Fossey, you are the one that is on the ground. How were these patients selected to benefit from this operation?
In fact, through the Ministry of Health, they are selected by the ministry and the authorities and the doctors, heads of departments there. So they are selected through that. And then in general, like say we had an open day at the church where we could see, consult and see different patients. We advertised that through flyer and the word of the mouth. Yeah. And we have seen actually in 2 days between Saturday and Sunday after the liturgy, at least about between 500 and 600 patients altogether. And there were also like mobile units that were from the Ministry of Health that we could use it as for dental work. There was like dentists working from the local doctors and then joined by the mission doctors as well. So that is basically how the patients were selected. And whoever came was very welcomed.
Okay, and they were helped.
Yes.
Okay.
Yes.
Now, Professor, I know that your team consists of a few specialists, but let's talk about living the knowledge here. Are you collaborating with the University of Namibia, per se, who are teaching the future doctors?
So one of the things that we are doing, we're doing a whole program starting today. Basically, every evening there are several lectures. There will be one day only about anesthesia, about 4 or 5 lectures. But each day there is 2 subjects, like, for example, I think today is gynecology and pediatrics, tomorrow ENT and neurosurgery, and so on. For the full 5 days that we are staying in Namibia, there are lectures every day. But also, I will be remiss to forget to mention that I think one of the benefits that we think that it will help for the future is teach young doctors who may need some technology or techniques to learn, and those are assisting in surgeries, and very soon they will be doing the same surgeries on their own.
Okay, great. Dr. Fossey, can you take us through the program? What places are being visited and when?
Yes, there will be on daily basis, starting from today, different schools to be visited, like CMANA and other as well schools. And there also, like, there is the outreach will go to like some other NGOs like Mamadou and others like that. So every day there will be like a team working in the hospitals. And then there will be the school visits and different places in the afternoon as well. So morning session, afternoon session, different places. And then from after 5 o'clock, 6 o'clock, there will be the UNAM lectures going on every day, from Monday to Friday.
Looking at how packed the program is, and now that you're doing the work in the Central Hospital as well as Katatura Hospital, will you still get a chance in the schedule to go to Omaruru Hospital?
I'm not sure if this year we'll be able to do it because the University of Health and Education, both of them have given us a very packed program. Yeah. And actually they are transporting a lot of patients from many places.
From outside
yes.
to here. Okay.
So, I mean, if I can show you the list of surgeries that my colleagues are doing, they hardly will get back to sleep for a couple of hours to start all over again tomorrow.
Okay. Final remarks. Let me start with you, Dr. Fawzi.
In fact, we are very glad in the church that it's not only the pastoral and sacramental services which the church actually offers usually to the congregation and to others as well, focusing on the spirituality and spiritual life of a person to become a very good citizen, that the church also is really very concerned about the outreach and the other services, like a holistic kind of aspect of service, looking also into helping the needy. And we choose the informal settlements, and actually this is a source of happiness to work with the people who really need the help, not only from the health matters as we see with the CMANA visit and alike, but it's also the other work that the church can give input into the youth, into making deacons, mentoring all these young people and the older people as well, giving education to and sessions of guidance, doing home visitations by our priest and the other servants to check even any social needs for the people and help them uplift as well.
Great. Professor?
Basically, we love Namibia, we love the people, and we are very much appreciative to the work and the assistance of the ministers and the deputies. They are really, without them, we could have not been able to do what we are doing. I'm very thankful to my team. I'm just one of many. I'm supposed to be a leader, but I can tell you they are working much, much more than me. And I'm very grateful to them. I'm very thankful to the group and grounds here because they facilitate so many things. And I can't begin to list them. I'm looking forward to come every year to do the same, and we see every year things are getting better. I can tell you we are very proud of the hospitals we are working on. These hospitals at the level of the American hospitals. So I'm very proud of what you guys are doing.
Okay, great.
I would like just to mention one last thing,
yes,
sorry
please,
if I may.
briefly.
There is our colleague, surgeon Dr. Saad, Yusuf Saad. He has been really doing enormous work arranging with the Ministry of Health. He's the contact person with the hospitals and the ministry. And of course, our priest, Father Mark Arsani, and the rest of the people without mentioning.
And Professor, will you detour in Egypt before you proceed back to the USA?
This time, no, I don't have time, but some of my colleagues are returning through Egypt.
All right, great. Thank you so much.
Thank you.
And keep up the good work.
Thank you.
Thank you so much.
And the saying goes, those who have Mass have hearts to give those who do not have. It's a living example here from the Coptic Orthodox Church, and they are doing medical miracles here in Namibia to those who are much in need. Jamenu, continue, and we'll bring you a sports interview after this.